At 6, a troubling rise in the number of strokes among a very different group of Mid-Southerners. The latest data showing a sharp increase among people under 45.
As we close out Stroke Awareness Month this month, Kim Clark examines the trend and what may be behind it.
Coming on in.
Loretta Plummer works in the emergency room at St. Francis Hospital in East Memphis. She's been a nurse for 8 years.
What is it about being a nurse that you love so much?
I love being a nurse just to have compassion for people, especially as an emergency room nurse. People come in on their worst days.
One of her worst days came about 5 years ago, 6 months after her son was born. Loretta was getting ready for work when she realized something was very wrong.
And then I realized my entire left side went down. I had the facial drooping. I had my slurred speech. So I sat there and I was like, okay, is this really happening?
Loretta knew she was having a stroke. She immediately called 911. Paramedics came and took her to the hospital.
I was in my mid-30s and, you never think about having a stroke or anything really that traumatic happen to you, especially if you're living healthy.
Loretta is part of a closely watched growing trend. Data compiled by the Centers for Disease Control and Prevention shows a nearly 15% rise over a 10-year period in the number of people between 18 and 44 who've suffered strokes. Tennessee had one of the most significant increases, almost 21%.
Everyone always thinks like, oh, my grandmother had it, or my grandfather had it, my great-grandma had it. But now it is starting to kind of trickle down into these younger patients.
What's behind the trend? Physicians say unhealthy lifestyle choices, genetic conditions, stress, drug use, and infrequent visits to the doctor. Becky Mitchell is Loretta's boss and director of the St. Francis Emergency Department.
A lot of times there's a delay in care because they may wake up at home and think, this is going to go away, rather than, having that knowledge and education to know that these are signs that you immediately need to seek treatment for. Call 911.
Early recognition and treatment can significantly improve your chances of recovering from a stroke.
Probably.
Call or see a doctor if you have sudden weakness or numbness, especially on one side of your body, difficulty speaking or understanding, vision problems, dizziness or loss of balance, a severe headache.
Time is brain tissue, so in a stroke, it's very important that you seek help immediately.
As Loretta knows, with early treatment, there is life after stroke. Even if you're in the prime of your life, she's living proof.
I actually had a patient not too long ago who was my age when I had my stroke, and she couldn't believe it was happening to her. I was able to actually talk intimately with her and say, hey, I've been where you are.
At St. Francis Hospital, I'm Kim Clark, Action News 5.
Well, stroke is the 5th leading cause of death in the U.S. and the leading cause of disability around the world. The CDC says managing risk factors like high blood pressure, high cholesterol, and diabetes can help prevent stroke, along with an active, healthy lifestyle and diet.